Meibomian gland dysfunction is one of the most common causes of dry eye, and it's often missed or not addressed effectively. And you might be thinking, why does this diagnosis matter? Well, it matters because there's 3 layers to the tear film. There's the aqueous layer, the mucin layer, and the oil layer. And the oil layer is produced by meibomian glands. The purpose of the oil layer is to coat the top of your tears and essentially to prevent them from evaporating too quickly. I like to think of meibomian gland dysfunction as a skin condition that affects the eyes. And why is this so common? We often ignore our meibomian glands. Just like your scalp, your eyelid margin has oil glands and hair follicles where your lashes come out of. And if you didn't wash your hair, it would get pretty disgusting. And that's the reality of what happens to our eyelid margins. And then in our modern world, we often don't blink enough. Blinking is really essential to the health of our glands and our tear film. So essentially what should happen is every time we blink, in an ideal world, our upper eyelid should meet the lower eyelid and there should be a little squeeze. And this squeeze should release clear oil onto the surface of the eye. And the purpose of that oil is to keep the water or aqueous layer of the tear film from evaporating. But digital devices cause us to blink poorly. And over time, this causes our meibomian glands to malfunction. When oil isn't coming out of them regularly, they tend to get plugged up. And then you can mix in there other causes of meibomian gland dysfunction. Common skin conditions often also affect the eyelids. How is meibomian gland dysfunction diagnosed? We need a careful eye exam to look at the eyelid margin. We look for things such as biofilm, which is a bacterial film that coats the eyelid and basically plugs the meibomian glands. There can be collarettes, which represent Demodex, which basically gets into the oil glands and causes a lot of inflammation. Then we need to look at the gland structure, which we can do with something called meibography. And then it's really easy to look at the oil quality by just pushing on the oil glands with a Q-tip. Meibomian gland dysfunction is a skin condition. It needs to be treated as a skin condition, and this is why drops alone don't fix it. Treatment must be targeted, inflammation must be addressed, and lid disease must be treated. What does effective meibomian gland dysfunction treatment look like? Well, it really depends on what the exam shows, but most commonly, unplugging oil glands, improving oil quality, addressing the biofilm, reducing inflammation. And then once you get it under control, you have to maintain the results as this is a chronic condition. This is why the right diagnosis always comes first and why treatment has to match the underlying cause.